The NBC6 investigators making a difference, helping to make plastic surgery safer.
It's unlike anything else I've ever seen before.
First, a worldwide warning showing the risk of complications in one of the most popular procedures. Then, a new law to discipline doctors. And now, surgeons announcing new recommendations they say will help save lives. And the number of deaths have grown. A woman died after plastic surgery just last week. NBC6 investigator Dan Krauth has covered this issue for more than 3 years. He joins us now with some new changes proposed for all doctors.
This weekend, a team of surgeons is presenting to an international audience the new recommendations they have on how the Brazilian butt lift procedure should be performed. They say the deaths we reported on are helping to make the surgery safer for people across the country. South Florida is known for its beautiful beaches and beautiful bodies, along with doctors who can help create those curves. It's why women have traveled here from across the country to get a better body and died.
NBC6 was the first to tell you about what killed a West Virginia woman.
It's happened again. Another woman dead.
Our reports grabbed the attention of surgeons across the country. The NBC6 investigators found at least 12 women have died from a Brazilian butt lift, including one just last week, a mother of 3.
You're putting your life on the line. I just don't think it's worth it.
Our investigations led surgeons to travel to Miami from coast.
We've been very concerned about the number of deaths that have been reported.
To coast.
We've got to look at this because it's a high death rate.
To do their own investigation.
I think that the reporting on this issue was essential because it really highlighted the presence of this issue and unfortunately how common this was.
The team of surgeons performed the procedure on cadavers using color dyes and X-ray imaging to figure out exactly what not to do when injecting fat. They found problems don't typically occur when fat is removed. It's when the fat is injected into a patient's body.
Patients need more protection.
Results show the safety of the procedure all comes down to this: the instrument the doctor uses to inject fat, called the cannula. Dr. Pat Pasmino of Miami says the task force is recommending all surgeons use thicker instruments like this and pay close attention to how they're injected under the skin.
The area that we are recommending to stay in is between the skin and the muscle. That's about 2.5, 3 centimeters. That's less than 2 fingers.
The study shows the further a doctor goes under the skin, the more likely they are to hit muscle.
In this example, the cannula has entered and it's way too close to the blood vessel.
The NBC6 investigators found a fat embolism was the cause of nearly all Brazilian butt lift deaths in our area. That's when a piece of fat travels through the bloodstream and causes a patient to stop breathing. Dr. Pasmino says keeping the cannula closer to the surface of the skin could prevent that.
The take-home message from all our recommendations for doctors is to always know where the tip of your instrument is.
Since surgeons can't see under the surface, Pasmino says he takes the extra step of using this portable ultrasound.
We want to avoid the muscle, so we only want to be in this space.
And urges patients not to avoid asking your doctor questions about how it's performed and what instruments they use.
If a patient is hesitant about asking a question, don't ask for yourself, ask for your children. Ask for your family, because those are the people that will be affected afterwards.
The team of surgeons is presenting their year-long results this weekend at a plastic surgery conference in New Orleans. The findings will also be published in the Aesthetic Surgery Journal this summer. Dan Krauth, NBC6 News.